Good afternoon, Team Edwards. I'm Chief Ward-Swanigan, the Installation Command Chief. I'm reporting to you live from the center of the aerospace testing universe. And today is the 22nd of July, so happy Friday to everybody. We've got quite a show lined up for you all. We're going to start off with our Warriors of the Week to highlight our Civilian Employee Support Liaison program. After that, we'll also be joined by Colonel Westy from Public Health. Captain Akwalia, I hope I'm saying that correctly, is the pediatrician that'll be joining us as well. And then General Higer will join us at some point in the program to kind of go through the COVID countermeasure update that we will be implementing next week. And so without further ado, I'd like to start off by just saying, you know, it's been a short week for myself. I just came back from leave, some time well spent with my children as we close in on the final days of the summer. And as always, you know, there's lots of catching up to do when I get back, but I'm always excited about what's waiting for me. The team is always very supportive in making sure that I'm caught up. And so let's get started with the Warriors of the Week, if you all don't mind. We have joining us Miss Whitney Sparks, as well as Mr. Robert Kessler. And as I mentioned before, these are our newest Civilian Employee Support Liaisons. And that's basically something that we started as the first in the Air Force. AFMC was very supportive in allowing us to bring this on. And what that is a similar program to what you see on the active duty side with first sergeants. And with AFMC being a heavily civilian populated organization, our civilians are also individuals that need support that's similar to what first sergeants offer our active duty members. And so we're excited to have them joining the team. So why don't we pan over to them and let them introduce themselves and then just kind of get into some questions and answers from there.
Hey, Chief, thanks. So, hi, everybody. My name's Rob Kessler, and 26-year Air Force veteran, recently retired, and super excited to be part of the Edwards team, and more so excited to be part of the civilian team where I can help and assist in making everybody more resilient and ready.
Whitney Sparks. I've been on base for a couple of years now, all civilian background, no military. Very excited for this new position and getting to work with everyone and that we're finally here and we get to do this.
Awesome, thank you. So can you please share with the audience kind of where you're going to be based in your roles and what those roles sort of entail, if you will?
Yeah, Chief, absolutely. So me personally, I'm living over in the MXG. Really what that's going to entail is I'm going to be there to act as a liaison or a conduit for the civilian employees and the supervisors to kind of make sure that they have all the resources they need to be resilient, right? So an example would be if somebody needs to connect with a VA, then I'll connect them with a VSO. Likewise, if we're talking about military assets, if we have somebody that needs some financial counseling, then I will hook them up with the AFRC. But you name it, like I'm the resource guy, so that's what I'm going to do.
Yeah, I think that's a perfect explanation. It's really just be able to have someone as that resource because you have your supervisors, you have your fellow employees and people in your world, and then this is just that position that helps step in there and builds those organic relationships throughout the day-to-day that says we're here for you, you're not alone, and we're going to get you the help that you need when you need it. And whether it's sitting in a room for you when you do want to make that call or taking you over somewhere on base so that you know where the resources are, you're not alone. And it's important that everybody knows they're not alone. And I think that's what a lot of what these positions are for, is to communicate that in a very tangible way for people.
So thank you for explaining that a little bit further in detail. I think one of the big points to make is that civilian employment versus active duty, there are some differences in how that is carried out. There are differences in how we support those individuals in different times of need, but there's also some similarities and some overlap there. And so I've been fortunate enough to have you all join our active duty first sergeants for our first sergeant council meetings and just kind of share your experiences. And I think that benefits both the shirts and they benefit you all as well. So if you have anything to add to that, please by all means.
Yeah, so absolutely. So really, when we talk about first sergeants, right, it's all about taking care of people. People are their business, and I think Whitney and I have the exact same motto when it comes to taking care of our civilian population. And so that relationship that we're going to have with the first sergeants, so that we can learn from them and so that they can learn from us, is going to do nothing but improve Team Edwards.
I think just coming from civilian and then coming to work on a military installation, there's a lot of learning to that and a lot of getting comfortable with it. But I think one of the things that I've learned that I thoroughly enjoy is that when you see those people that help one another, and it's not airmen, military or better, or civilians, it's not about the competition of it all, or it's not about here's what we can do, well, here's what we can do. We get to do this together, and we get to learn from each other. So even these positions and getting to work with the military first sergeants and learning, there's a lot of similarities, because at the end of the day, we're all people, and we all just need each other. We need help, and let's do this together. So if a military member were to come up and ask for help, the reality of it is I know some military first sergeants that I can hand you off to, and there's a smooth handoff there, and likewise from them. So I think we all get to work together, learn and grow, and we're trying to accomplish the same thing.
Very good point, ma'am. I know when I first arrived here, I had the pleasure of sitting down with you and your boss at the time to just kind of talk about the various engagements you had already been doing prior to us bringing on this new role. And so I think it's very important, as I mentioned before, with us being civilian heavy in this organization, at the wing and at the command level, that we do our best to break down any barriers that may exist, or any division between the military and the civilian populations. And so I was pretty excited to see that you were actively doing that, and I was definitely on board with the concept, and I'm just glad that we've arrived where we are today with it. So, sir.
And speaking of arrived, thanks for kicking off, everybody. Happy Friday.
Wait, you're not on. Sorry.
Not on? Can you hear me?
You got to turn your power on. So while General Higer is turning on his microphone, I will point out the fact that he is trying to show me up with his orange mask, and I typically am the one with the orange mask, but like I said, I've been out all week, and so I totally forgot what day of the week it was, and I came in asking everybody how their weekends were, because I was feeling like it was Monday, but in actuality, today is Friday, and that is when we generally wear our orange masks. So good on you, sir. Did you turn it on at the top?
I think so. So how you hearing me, teammates?
Good to go.
Good. All right. I got it good to go from the B cubed. We'll get that call sign out later. All right.
So, sir, you're just in time to.
Hi, teammates. Happy Friday. This is a rare. This is such an exciting moment for me to have the two people that are also in the studio with us today. Chiefs already let them do their introduction, so I don't want to rehash anything that we've already covered. But we have some Warriors of the Week or high performers, and just to get to these two jobs, these two are already high performers. As you can imagine, there were a lot of people that said, I can do what? As a civilian? At Edwards? And they pay me?
Right.
Yeah, I mean, yeah. So we're very, very fortunate to have selected these two and have these two here. One of the things that I want to highlight, Chief, if you've already hit this, please cut me off. But there's a misconception that I'm happy that we dispelled, and that is, this civilian first sergeant thing is just going to be a jobs program for retiring shirts, and that is not at all the case. It's competitively selected. If you have the right qualifications, even if you don't have the perfect experience, we'd rather have the person there that we can then train to the perspective. And both Whitney and, is it you go by Robert?
I go by Rob, sir.
Rob, all right. So, see, I've just met him. So Whitney and Rob are both great examples of that for the team and, frankly, for the entire MATCHCOM as AFMC leads the Air Force on how are we going to take care of civilians. Analogous to the way that we have been taking care of airmen for a very long time. So I'm thrilled they're both here, and their paths to get here were both very circuitous, longer than I would have liked, but the bottom line is they've arrived and they're dominating. So
Yes,
I'm glad
sir.
you're here, teammates, and we could not be more pleased to have you. And I'll ask. I have one favor of you. for both of you. So are you guys ready to do the favor? Write me the blank check.
Ready, sir.
Yeah, you too, Whitney? All right. I expect a solid pile of dirt on Dano. Okay? And I don't think you're going to find any, but he is so Mr. Osborne, Mr. Dan Osborne, Dano is their official supervisor of record, and that was so that we can emphasize to everyone that these are wing level assets, just like the first sergeants. While they don't officially report to Chief Ward-Swanigan, they de facto report to Chief Ward-Swanigan. And to have that level of cross-flow and cross-talk and functionality at the wing top 5 was our vision with doing that. And then the bonus for these two is that they get to work with Dano a lot, and I know they'll appreciate that.
Absolutely.
So, anyway. All right, Chief, back to you.
Well, we were just wrapping up our question and answer session with our newest, should we call them Cecils, or should we say
I don't
it out
know.
each
So
time?
how about we take a survey, and we'll start with Rob. So Rob, what do you think we're going to end up calling the position or your positions?
Sir, I think that's going to come with the development of the program. I think right now the Cecil is where we're leaning the most, though.
Whitney, same question. Don't be influenced by Rob.
Right, so much pressure. Well, the reality of it is I'm already being called that in our squadron and group, so I think it'll stick.
CESL, pronounced Cecil.
Unless you have, what's the other option? Like,
I
what
like
else are we
Cecil.
going with?
Well, I don't know. How about I'm sure you two will be back, and you'll be around in many forums. It's great to have you on the team. Thank you for doing what you've been doing for airmen all along and throughout your careers, and thank you in advance for what you're going to do for us in these positions. So to the audience, those of you that are watching live and those of you that might watch this on a replay, if you have an idea on what we could call these two that doesn't offend anyone or make anything, violate any policy, like we started this as the civilian first sergeant program, and a lot of people said you can't use the term first sergeant because they're not. I'm willing to push on that a little bit if we think that's where we want to go. But if Cecil's the right answer, then I support that too. But so if you have an idea or a suggestion, text it in. We'd love to get it. And as you interact with these two, let them know what your thoughts and suggestions are as well. This is a beta test. I think the beta test is going to go swimmingly well, and then the scaling as we test and then operationalize it will be, do we need 10 more Robs and Whitneys, or do we only need 2 more? And that'll be the real, as we operationalize it, how many more of these two and their exquisite leadership do we need? Not is the concept viable, because we all know that already, and the answer is a definitive yes.
I think that's perfect. Given the nature of our numbers here in the wing, it's the perfect complement to the 7 active duty first sergeants that we currently earn, to just be able to spread out that support throughout the wing in more locations than we currently have, and just build upon it as we go.
Right. Parting shots, Whitney, for today. You'll be back, I'm sure.
I think I'm just excited to be here. I'm excited the program's on and moving, and I think it's amazing what we are going to be able to accomplish, and we need all of you. This isn't just a Rob and Whitney show. It's a base thing. It's a team effort, and hearing what we can do to help and how we can do it better, where we need to shift, that's needed so that we can fully accomplish what we need to do to organically help everyone and meet you where you are with your needs.
Is your last boss through his mourning at the loss of you yet?
We're working through it.
Okay, good. Good. How about you? Parting shots, Rob.
Yeah, I don't think I can say it better than Whitney just said it. I'm just super excited for Team Edwards and super humbled by the opportunity to be part of the team. So,
Well, glad you're both here. Thanks for doing everything you do.
Thank you.
All right, we'll let them sneak out of the studio while we swap in our next superstars and experts. While they're swapping out and handing off mics, there's a couple chart decks that I want to show here. So if you could go to the chart that shows at the bottom. Should have gotten it from the CAG, PA teammates. That shows the differences in protection measure. The difference between the bottom of it will have on the left side Bravo, and on the right side Charlie. And it's on the back of it. Here we go. It says COVID-19 local on the top. And then the bottom it says DoD guidance for Bravo, and on the bottom it says DoD guidance for HB on Charlie. It's if you don't have that chart, that's not it. If you don't have the chart, I'll talk to it. while you're trying to find it. So you can flip back to me while you find it, or you can hit up DJ, who I think is in the audience there. So folks, while Lieutenant Colonel Westy, our public health emergency officer, and her counterpart, who I'll let her introduce, are here, are getting in the studio, I want to foot stomp a couple things. The counties that our bases are in, so Edwards and Plant 42, are Los Angeles County, Kern County, and San Bernardino County. The COVID levels in our nation are by county, and they're low, medium, high. All 3 of those counties are now high. Omicron BA.5 is the culprit. And they're high for different reasons. And if you don't understand what low, medium, high mean, other than green, yellow, red, I encourage you to do so. They can be red or they can be high for various reasons. And depending on what those reasons are, will drive variations or differences in how the installation responds to those changes in the COVID level. For example, if we were red because all of the ICUs were full and all 3 hospitals were on divert status, and the fatality rate to this version of COVID was approaching something resembling Ebola, we would be in a very different HPCon posture than we would be if the hospitalization and death rates were almost minuscule, even if it was highly infectious, right? So those are very different levels of low, medium, high, in this case high, and they will drive different levels of responses by the installation or the installations because of the requirement for us to continue to execute mission going forward. So with that as kind of an introduction, I want to highlight a couple measures. So the DoD guidance items that we are recommended or have to do at Bravo, at HPCon Bravo, are you have to reconstitute screening testing. Masks are not required. Your facilities indoors are limited to 80% capacity. There's no restrictions to base access. There are no restrictions on the size of the people attending a meeting or an event. And then there's I'll say normal telework posture. Contrast that when you drop to Charlie, where if you just do rote application of the higher headquarters guidance being the important phrase here, you're still doing screening testing. Masks become a mandate at community level high. Occupancy drops from 80 to 50%. You're supposed to limit non-mission essential base access. Everybody hear that? Non-mission essential base access. And events that are 50 or more require because we're community transmission level high, require Undersecretary of the Air Force level approval for them to be done. You're supposed to push towards a maximum telework posture, and then you make all your dining facilities takeout only, you close the gym, and things like that. So there are some major changes or major implementation things between the baseline HPCon Bravo and the baseline HPCon Charlie. We are going to change some of our protective measures next week. We're going to phase those in. I have not yet signed the installation command directive, but it's pretty close to being ready to go. I'll push out that either late today or very early Monday, probably late today with an implementation over the week next week. You can anticipate a couple things: that we're going to potentially throttle back occupancy, that you are going to be encouraged or required, actually, if you have an event indoors of 50 or more, that you seek an appropriate exception to policy, route that through the Commander's Action Group or the CAT, and we have a pretty expedited staffing process that can get to Secretary Ortiz-Jones for you on that. And if you have a question on the applicability of the guidance to your event, please also ask the CAG, and I'll give you the local read on whether I think that's an appropriate meeting the Undersec-F intent or not for that. As an example, an outdoor activity where you might have a gathering of people at a picnic that is 60 people. It's for a limited duration of time. Is that a 50-person event? It might not be because A, it's outdoors, B, it's a limited duration, and C, you tell me that we're not going to seat everybody inside this little tiny picnic area, that there's good spread out and good smarts application that's already built in. Those would be the kind of things where I am comfortable saying we're meeting the intent of the policy, even though you're slightly over what could be the 50-person limit. Other ways to work within that, we're happy to handle with you and the CAG as well. So that's something that we have to do, and we don't get a choice to do because of the community transmission level. The other thing that we don't get a choice to do is masks. And so Chief, I thought this would be a perfect double slam dunk, but I put my orange one on today because that's Test Wing Orange and it's Friday. But I do want to talk a little bit about masks today. So I'm going to give you a tee up on masks, and then I'll let Highlander correct me 100%, and then we'll look at some other discussions there. But I also want to make sure we give Lieutenant Colonel Westy, and I'm so sorry I didn't get a chance to formally meet you in the hallway, the pediatrician here to talk about vaccinations. And we had a question earlier on vaccinations as well for kids that I couldn't answer, but I knew the two of you could. So let me talk about masks and what we're going to do for masks. We are going to implement mandatory masks indoors at all facilities at all times, 24/7 at Edwards Air Force Base with this ICD change based on the community level of COVID. So the community level is high in all 3 counties. We work in those, some of us work in those places. All of us live or at least frequent those places in our off-duty time. I cannot control, but I certainly can't influence what you do or what you're aware that should be done when you go to a big box store, when you go to a restaurant some other place, when you choose to go to a concert. I can't control that, but I can certainly give you the tools and the information to allow you to minimize your risk, because your risk is risk to us in the mission, and that's really what we're driving at in a risk to mission posture. There are certainly individual risks that can be mitigated as well, and I absolutely care about those, but it is risk to mission that we're trying to balance and modify here. So masks, 100% masks are going to be required in the not too distant future for Edwards. So let me show you a couple things that are not approved masks. If you want to wear orange and you can, you're totally good. But the type of mask that I have on my face right now is known as a KN95. Can you pan out to the larger view for me there? B cubed, thanks. So that's what's going to be expected. KN95 or equivalent. Equivalents are KF94s, N95s, and a well-fitted surgical mask. Those are examples of equivalents. I don't recommend the surgical mask. They're not as durable, but they will work in a pinch if you need them. So everybody remember this? Everybody remember this? It's the cutoff t-shirt thing that you wrap twice around your face. Well, that is so early 2020 and no longer applicable. So don't do that. That doesn't count anymore. Everybody remember this? This is the one I wore off duty. It's a balaclava. I could double it up, and a double was better than a single. It's cloth, so it was going to catch the droplets as it exited, but it was going to give me very minimal inhalation protection as well. That was better than the t-shirt, because I could double it up and maybe even triple it up to catch what I was exhaling. But again, I don't know. What do you think, Highlander? That was so mid-2020. That's not acceptable anymore, nor should it be. And then here's one that surfaced that a lot of people, I saw a lot of people wear, and somebody gave me an example of. This is not the right material. You can't tell what it is, but this is a synthetic material that if I hold it up to the light, I can see through. It probably wasn't ever catching the liquid droplets anyway. But this type of material or anything that you can see through was never going to work, and it is certainly not acceptable now. I can't even say this was so whatever, because this was so whatever wrong and so whatever never appropriate. So don't try. It's not appropriate, and it won't meet the intent. Now, this is the one, or one of the ones that I wore a lot, right? Test Wing Orange. It's a double, and in some cases triple, cloth mask that I could launder. It fit relatively tight, and it worked for a long time. But what we're learning now, and what we've learned about Omicron especially, is that this is an okay exhalation protection for those that are around for larger droplets, or if you cough or sneeze to catch that. But it did very little, it did some, but it did very little to protect the wearer from inhalation risk, which is why this is so 2021. So here we sit, Chief, in 2022, and back to what's on my face and has been on my face when I've worn a mask, which is a lot in 2022, including when I travel, when I'm on airplanes, when I'm in hospitals, because you still have to wear them in all medical facilities. The masks that you are going to be required to wear are for your inhalation protection, because BA.5 is aerosolized, and all Omicron variants have been. It has nothing to do with your vaccination status. It has nothing to do with your ability or likelihood of transmitting. It has everything to do with you not inhaling it and taking it to your work center, or taking it home, or becoming yet another person that is, like the president, that is a case where you have to isolate and work some other drugs. So that's a little bit more on the background why. What you'll see in some of the charts, let's see if I can call up the chart, and then I'll hand over to Highlander here. How about the one that has a picture of the masks on the left side? I think it was Highlander's chart. You guys worked that? Let me see. It is titled, Why Wear a Mask? If you can find that and call it up. It's 3 charts across the middle of it, and the one on the left side says, people who reported always wearing a mask in indoor public settings were less likely to test positive to COVID-19 than people who didn't. Statement on the top of the chart. If you guys can't find that, get a hold of DJ and have him send it to you. Wearing a mask lowered the odds of testing positive by 56% when you wore a cloth mask, by 66% when you wore a surgical mask, and by 83% when you wore a respirator, which we define as an N95 or a KN95, so protecting you from inhalation. An 83% reduction in your odds of testing positive to COVID. And that's a chart. By definition, all data is historical, and things have changed a little bit. But it's the chart. It's the chart in the middle there that we're showing right now. Those are significant reductions in your future testing positive that are enabled by a mask. That is paramount now that COVID is endemic, especially when we see surges. The sources for those data are 10 of them, and they are places like the American Association for Aerosol Research. They're from a non-CDC affiliated lab. They're from the Proceedings of the American National Academy of Sciences. They're from the National Institutes of Allergy and Infectious Diseases. They're the results of a California COVID-19 case control study team. And then there's also sourced in here the California Department of Public Health. So this is way beyond General Higer said, way beyond Chief Ward said or does, way beyond CDC says. There's a lot of solid scientific background over months and tens of thousands, if not 100,000 or more cases, that show wearing the proper mask is the only way to move forward through the endemic when the community transmission levels require it. And so that is why not only mask wear is what we're going back to, but we're going to go back to wearing a mask that really makes an effect if we're going to do it at all. And so with that as my tee up for you, Highlander, please correct me to 100%. Add on any other foot stomps you want to do on your slides, and by all means introduce the person that you brought as your I understand to be a pediatrician wingman.
Yes, sir. Thank you. Yes, I have Dr. Qualia here. She's one of our base pediatricians, along with Dr. Scarberry. So I brought her in to help talk about the vaccinations, especially for pediatrics, for our kids. But I just wanted to kind of revamp and show the slides here for why we're kind of going into this increased measures. And really it's because of that BA.5 variant, as General Higer mentioned, is so much more transmissible right now. It is a new variant that has mutations on it that really helps escape horror immunity from vaccinations and previous infections. So it really is driving up the surge. We've actually been on a surge, and I know people don't realize it, but we had that BA.1 surge back in January, and then we actually have been probably in the last 6 weeks in a BA.2 surge in the kind of subvariants of the BA.2. So this surge, this BA.5 is actually a surge upon a surge. So that's where we're really seeing the kind of steadiness that we've had in increased cases, and it's going up dramatically again with that BA.5. It's actually, that variant's kind of taken the globe over and has increased numbers in the whole entire world, not only in the U.S. And the concern is really that it is prevalent in the U.S., but it hasn't even been the most prevalent. There is still BA.4 and some of the BA.2 is still circling around. So we are definitely feeling it. And with school kind of coming back into session in a few weeks, this is going to really increase transmission even more. So hopefully, I know the slides aren't up yet, but the slides are on the Edwards COVID page. There it is. The slides are on the Edwards COVID page as well. So if you do go to the Edwards COVID page, we try to put out weekly slides with updates. So please feel free to go there. Every week we're trying to do it on a Friday, just to have some awareness of what's going on for COVID. But as you can see, the case rate is been steady, like I said, but it is starting to go up again. And what's really concerning is that test positivity rate. The people that are getting tested are testing positive more. The percentage is really, really high. And we know that the cases are underreported. So what you see is not really the reality of the situation in terms of number of cases. The cases are definitely higher than we were even in the winter of 2020. Even when we had the Delta wave, we are definitely having more cases than what we see because of the home tests. People are testing at home. They're no longer really reporting it to public health unless they report it to a doctor who then reports it to public health. The numbers are not being captured. But that test positivity rate can kind of show a little bit where we probably are at. And as you can see, it's pretty high, almost as high as the January, the winter wave of 2021. So my real concern is that it's going to reach to where we were in January or even higher than that. As like I said, we're not quite at the peak yet. So that's kind of where the concern is. We are also seeing our hospitalizations increase because of that. And as you can see in the map, most of the U.S. is in a high level or at least medium level. So that has increased quite a bit over the last few weeks. And so that's really where the concern is. There's another variant that's coming up that they're finding BA.2.75. That's maybe even more transmissible than the BA.5. So there is definitely more to come. This virus is mutating quite rapidly, much more rapidly than things like the influenza virus. And so we have to just be really ready to be able to have all our defensive postures up and ready to be able to protect ourselves. And one of those is vaccinations, and we'll have a little bit more on that. And I can show you the local community rates are also have been increasing. And like General Higer mentioned, all of the Southern California is at that high community level. That's kind of the local rate, just to be aware of. And those cases are increasing. Again, hospitalizations are increasing. And the thing with Omicron is that people may not know they have it. People can have very mild symptoms and not know that they're positive. So really the emphasis is testing as well. Make sure you're testing. If you have any type of symptoms, especially sore throat, if you have a sore throat, definitely get tested because that's really, really a lot of times what the presenting symptoms are. Really, it's pretty rare now for people to have fever and cough. It's really that sore throat, headaches, and fatigue. So if you do feel any of those things, please do make sure to get tested. Be aware that sometimes the test up front may be negative. I've had a lot of patients who have tested frequently and they were negative, and then all of a sudden positive. Especially if you were a close contact with somebody, just know that the incubation period can be a little longer and it can actually test positive later. So just be aware of that testing. And so it's layers of protection, right? So use your smarts. This is something
Highlander,
that
let me flip up a couple things here. So what Highlander is talking about there is that the data that we are now tracking for case rate and positivity rate, those are only the cases and the tests that are getting reported to public health. There are some estimates that we're off by an order of magnitude. And if we're off by even a fraction of an order of magnitude, we're already at case rates well above what we saw in the very definitive spike in January with the original Omicron surge. The case rates the reported case rates in LA County, San Bernardino County, and Kern County are in the multi-hundreds per 100,000 case rate. We used to freak out at 100 cases per 100,000, and now we're in the I see the data here.
it's like 400 per 100K.
Yeah, so the data as of July 21st, and it's gone up since then, are 481, 339, and 375 cases per 100,000, and those are just the reported ones. So if they're off by a factor of 2, now we're talking 1,000 plus cases, or approaching 1,000 plus cases per 100,000. That's an infection rate greater than what we've seen anywhere. The good news here is that while the infection rates are unprecedented, hospitalization and deaths are not. Those are always lagging. And remember, there's a large segment of our population that can't get the benefits of the vaccines or they have additional comorbidities. And so those are the folks that I think we have I'm telling you, we have a moral obligation to protect those folks that are our coworkers. And I assert that we also have a moral obligation to protect those that are our coworkers that live with people that are at high risk and can't get the full protection or the full benefit of a vaccine. And those will, if we do those things, we will also protect our mission, which is where I'm driving at here. We'll get to the smarts here in a second. There's another, on that same chart, why mask? It's a 2x2 matrix. I'm a data person and I love data, right? And I love charts that show data in a very illustrative way. But it's if you wear a mask and the other person in the room wears a mask and one of you has COVID and the other doesn't, it talks about how much time do you have to be with that person to receive an infectious dose. So I heard early in the pandemic, the dose makes the poison. And that is very true for this type of a disease. One single cell of COVID does not mean you get it. Yeah, there it is in the top right chart there. If you read in the notes, well, first of all, if everyone in the room is wearing an N95, KN95 mask, you need to be in that room for 25 hours, statistically, for one infected person to transmit it to anyone else. So go back to the chart, please. That is a significant additional reduction in risk of transmission and therefore risk to our mission than if we just wear surgical masks, where if everybody's wearing surgical masks, now if the meeting's an hour long, there's a risk of transmission there. But there's another note on this chart that I find amazing. By the way, this is Omicron, so this is not an earlier version. This is Omicron. Those are N95 masks that are not close-fitted and sealed. If you have a tightly fitting, sealed N95 or KN95, you'll need to be with that other person for 2,500 hours. So just putting the KN95 on your face and making sure everyone that you're with has one on gives a serious level of protection. And if you're the person that walked in unknowingly contagious, it also helps exhalation risk as well. But you can see the benefits of everyone wearing proper masks. And then reference the cloth masks. If everybody's just wearing the cloth, you're talking on the order of 25 to 30 minutes. So
Sir,
that's the way.
Based on that data, I'm hoping that is accounted for when we talk about no more than 50 and those sorts of things. If we can be in the room for that many hours,
it
we're
is.
all wearing this.
And those are the kind of things that when we do have an event like a change of command or a retirement or an ALS graduation or something along those lines, where I can say to Secretary Jones, I endorse this, and oh, by the way, at Edwards, the only acceptable mask is an KN95, N95 or equivalent. The duration is good. Now you can pull up the SMARTS chart. And I need us all to go back and continue to use this chart. I think it's a very memorable acronym, and it's layers of protection. So if you don't have to give someone a hug, don't, right? If they need it, they need it. But if they don't, respect somebody's space. I am a lot less close around folks than I was pre-pandemic, and that's just a change that's going to happen to humanity. A lot of folks don't certainly understand or respect that. I mean, this ain't over, it's now endemic. So space matters, indoors and out. Mask matters. We're talking about masks a lot. There's a lot of pushback against masks don't do anything. Well, that's not true. Depends on what the mask is, but it can do a lot. And if you want to talk about infectious diseases work, you can talk to the experts like those who are in the room with us. They intentionally go into places with people that have highly contagious, highly deadly diseases wearing the type of personal protective equipment that most of us are now going to be have on and around us. Now,
I wonder if the people who said that have their mask below their nose.
That's a great question, Chief. Yeah. Or that you could see through it. Airflow makes a big deal. Outside, much better. Moving air better than still air and those kinds of things because this is aerosolized. Keeping it smaller is better. Keeping it shorter from a time duration is also better. Remember, the dose makes the poison. We have plenty of tests available now. If you know you're going to a big event and you have an antigen test at home and you can test before you go, that's an awesome time to find out that something's not quite right before you feel the symptoms a couple days later. And then you have to be the person that walks in sheepishly and say, oops, it was me, teammates, right? So testing is important. They do have expirations on them. We have a screening facility where commanders can send their folks or allow them to go as a way to reduce the spread of risk. And then vaccinations, which is where we'll pivot to next. Vaccinations are not, and to be really blunt, they were never designed to prevent the person from getting the virus or from spreading the virus. They were designed and targeted at reducing severe disease, so hospitalizations and death. And by definition, the less sick you are, the less you load shed the virus as well. So there is some secondary benefit to you not spreading, but it was never designed as immunity. And I think, unfortunately, we got off on the wrong narrative about a year ago for shots. And to the extent that I have the ability to correct that narrative and those applications, I will always do that. So with that, Highlander, I'll hand it back to you two and talk about shots. I know there's a bunch of folks that have questions about how can we get kids 6 months to 11 years their shots? When is it here? When's it available? And then the other question that I have that I'll be interested to hear an update on is when are we going to have Novavax for those of you that wanted a traditionally developed vaccine that didn't have any fetal stem cell lines used in the testing? So over to you two.
Yes, sir. So I do have a slide as well, just to show where the update vaccine, if you're for the vaccine schedule. So recommended for everybody to basically 6 months and up to get vaccinated. Boosters are available for everybody 5 and up, and then if you're 50 years old or older, then you are recommended to get a second booster. There's another chart for those who are immunocompromised. So if you are immunocompromised, you do need more vaccine to help build immunity. So that's kind of the chart, and there is guidance on the CDC website if you're wanting to know if you're up to date or not. But being up to date on the vaccine is really important. Unfortunately, only about 34% of people who are eligible for a booster have gotten it. So that's a very, very low number. Right now with Omicron and the current surge, getting your booster now is really, really important. But the good news is that we are able to vaccinate 6 months and older. And so I'm going to move it on to Dr. Qualia to discuss that a little bit more. And there's a slide for her as well.
Hi, everyone. It's been a while since I've been on town hall in the beginning of the pandemic, but I'm glad I'm getting this opportunity to talk to our base and our population. We did receive our shipment of both the Pfizer and Moderna vaccines for those 6 months and older, and we are going to start vaccinating on Monday. If you've seen our MedGroup Facebook page, we have the QR code and the website link to start booking those appointments. It is the same DAP system, if we could get the slides up, that we were using at vaccinating at AFRC and all of those other locations. But even if you just do a quick Google search of Edwards, DAP, it's right up there, you can go ahead and book. You have both options, both the Pfizer and Moderna for you. They're slightly different in both the vaccines. And the question that we have, it's all 6 months and older, all TRICARE beneficiaries. So if you're a civilian employee, but you have TRICARE Select or Prime, our immunizations clinic is open for you to receive, and your children to receive that vaccine. The appointments are only for the 6 to 4-year-olds, 6 to 5-year-olds. If you are 5 and older and are needing the booster or your first dose series, that remains our walk-in Wednesdays for peds and all days of the week for the adults. And the reason for those limited hours is to not waste vials. As you guys remember, that once we open a vial, we have a limited amount of time to use it up before it goes in the trash. So limiting the number of days that we're offering it will allow the most amount of people to get the vaccines.
So let me go out on a limb here and state to the audience, because of that expiration timeline, once we pop open vials, we would rather, we would much rather, as an Air Force, as a community, and as a base, offer it to folks that aren't TRICARE beneficiaries than to throw it away. If you are, however, not a TRICARE beneficiary, I wouldn't plan on that. But if you are interested in something standby end of the day or end of the week as we approach those expiration points, that is something that we would certainly consider and will do if we can make it happen. I would not plan on that to be your primary. Endo, by the way, these are available at most places where you can get shots for young humans anyway. So we are not the only source in and around the installation. So I think that's a super important point to hit there. We're all in this together, and if we can help, we will. But our primary purpose and our primary authorized purposes are TRICARE beneficiaries. All right.
Novavax.
What's that?
Novavax.
Novavax.
Yes, so Novavax is another vaccine that is now CDC approved. So that's really very encouraging news. This is our 4th COVID vaccine that we have available in the U.S. and it uses a more traditional platform than we've had. So that's kind of a slide that kind of shows the different vaccine designs. But this is a very traditional vaccine platform. It did not use any fetal cell in research or development or manufacturing. So that may be something that people kind of were looking for, and also that traditional technology. It is 2 doses for that primary series, 3 weeks apart. And then it is something where it's basically just the spike protein. So there's not like an mRNA telling your body to make spike protein. It basically is a spike protein, and it's added to something that will help the body make the antibodies. And it's, like I said, a traditional vaccine. So that will be available. It will be available in the community probably starting around August. I know that they were mentioning that there may be some short supply on it. So please just continue to look out for that for once that kind of gets out in the community. So I think communities can start ordering it next week, but it will take a little bit of time for that shipment to come out. So that's the prediction, that it probably will be available potentially by the end of July, but probably more likely August. I know the DoD will be shipping it to some MTFs, but that will be probably more mid-August when it will be available. And again, maybe a limited quantities initially, but as more and more gets manufactured, it should be more available in the community. But definitely look out for that. If that's something that's more, a bit more kind of what you've been waiting for, more conducive to you because of the different platform that it uses, definitely still get vaccinated because it is very effective and it will protect you.
Yeah, there were a lot of folks that I talked to throughout the vaccination phase, the early vaccination phase of the pandemic, that were a little bit trepidatious on the new technology that was mRNA vaccines, even though they've been around for a couple decades. This is just our first big use of them. And there are also some legitimate questions raised by some folks around the testing of the previous 3 authorized ones. And Novavax, to my knowledge, has none of those restrictions. So I encourage you, if you're not yet vaccinated and you're holding on either or both of those, to please look it up and go buy yourself that protection against hospitalization and death. There's a question here on masking, and I also want to go back real quick to the chart that says information for parents and caregivers of children ages 6 months and older. So you call it that chart, and I'll read the question here. One of the things that I want to highlight is that these charts are not just available here. They're posted or going to be posted at the Edwards site as well. So as you have questions, or if you notice an error or you need clarification, provide us that feedback, and we'll get it to you. So our question is, while this is on the screen, will the KN95 or equivalent mask requirements apply to children at the CDC? So I am going to let the CDC, as the experts in caregiver to children, work with the pediatricians on base and decide what they're going to do in their facility. The reason that I say I'm going to let those experts figure that out is that there are some significant drawbacks to having a mask on a caregiver of a child of that age and on the face of a child of that age. For example, under the age of 2, it's hard to tell when they're having breathing distress or other things like that, and that may or may not be the best way to go for a young child. The reason that caregivers not having masks on is that as a person develops in their language skills, they need to see facial expressions, tongue and mouth movements. And so there's some nuances there, and we have to balance the protection against transmission from the loss of learning or the risk to the young folks there that are in the CDC. So I'll let those 2 experts figure out what the right answer is and what the right policy is. But I will pound my boots on the ground until you can hear me at 3 counties away. If you are an adult and you are walking into the CDC, you will have an appropriate mask on. And just because we don't require it of your children doesn't mean that you are not also required to have the same thing. We can talk about the efficacy of that, and that's a legitimate discussion to have. But I think this is a good statement opportunity, and it will also apply to all the other facilities on Edwards once we make that mask requirement. So, ladies, doctors, you want to correct me 100% or answer the question on what age for masks, and where do you think the CDC is going to land? CDC, Child Development Center, not CDC, Centers for Disease Control, because you can't use too many acronyms that are the same in the same sentence.
Yes, sir. And then being the CDC medical advisor for the installation, going on a limb, because obviously I haven't talked to Miss Latia or anyone there yet, but it'll probably be similar to previously where the youth center and the school age annex having the older than 5-year-old group who can have the communication skills to know that this is important, have done it in the past, will likely go to masking. And then the younger kids who still do nap time, because we can't have them wear a mask while they're sleeping, as a 3-year-old or 4-year-old, the CDC will probably be a little bit more lax with the children as opposed to the school age annex and youth center. And then the adults would fall in line with General Higer's recommendation.
So to be determined is the real answer.
Correct.
My point is that the installation commander directive is not going to get down to that granular level for a bunch of reasons. Number one, you don't want me to, right? That's not my lane of expertise. And I need to continue to show that the facility owner and the experts that support that facility or mission owner, they have my full faith and confidence. I trust them to make good decisions for the right reasons, informed by the right experts. Within the bounds, left and right boundaries of our policy constraints. And so there's lots of latitude there for the CDC director, advised by her pediatrician and her medical advisor, to do the right thing as we are in an endemic set. So thanks for that answer. Charts are up. We'll get. How about we tee up a couple medical questions? We'll answer maybe 2 or 3 of those, and then we'll pivot off to anything else. And then before our medical experts leave the studio, I want to reemphasize just a couple things. So the first question we have is, do I need an appointment to get my next booster shot?
No, you do not. So if you're an adult using the adult vaccination, so any person 12 and older, you do not need an appointment. Those are offered on a walk-in basis as daily operations. That being said, depending on the ICD that goes out on Monday, the med group may have to make adjustments to our flow, but at this point, walk-in for anyone 12 and older. 5 to 11 is Wednesdays, and then the 6 to 11-year-olds are as per schedule.
And so any difference in efficacy yet that we've seen on the mix and match of initial shots, initial series versus boosters yet? Or is it still boosters with mRNAs are the far superior, and it kind of doesn't matter if it's Pfizer or Moderna?
Correct. The booster dose could be of either mRNA variety.
And we're not seeing any split in efficacy between those two still?
Not yet.
Okay. All right. That question is really not a medical question. It's a supply question. So the question is, will Edwards Air Force Base be supplying KN95 masks? And if not, what is the best way to get those? Well, to be really blunt, you can order them offline. Most stores or many stores have N95s or, in a pinch, surgical mask equivalents. What we're seeing for cost on KN95s, N95s are slightly more expensive, and the big difference between the two is not the material, but how it's attached to your face. Is they're somewhere on the order of 50 cents each. A surgical mask is about 1/10 of that. They're not as durable, they don't last as long, and they're not quite as efficacious. But we will have in our supply system masks, and we will be distributing those. We'll be distributing KN95s. We don't have the supply yet, but when we do, we will be distributing some. Do not wait. And oh, by the way, these are things that you should all have with you because you'll need them in medical facilities when you go see doctors. You'll most likely want to continue to wear them in high dense areas in public, like airplanes and airports and public transportation and things like that. So I recommend you have a few anyway, and we will augment you with the ones that you need to do your official duties when we have the supplies around and available. And so yes, but I think is the answer. Will Edwards Air Force Base provide those? These masks are not wear once and throw them away. They're wear them until they're no longer clean or they've somehow been exposed or compromised, and then you can go on to your next one. Surgical masks are a little bit quicker to do that. So I hope I answered that question. All right.
If I can say, sir, there's sometimes you can go to the drugstores like CVS or Walgreens, and they will have N95s for free. If you go on the CDC website, there's also get a free N95 locator, so you can go on there and also get that too.
Yeah, lots of places you can buy boxes of 50, 100, 150 KN95s, and they are reasonably priced. We will be issuing some as soon as we have the supplies. All right, so here's a question for the pediatrician, which I guess applies to both of you, but the person that's here in her pediatrician role, please discuss the risk versus reward factors to consider for vaccines for children, recognizing that this is only an hour broadcast and we have 5 minutes left. That's a long discussion, but just a couple quick highlights on the risk versus reward for the youngins, please.
So the risk versus reward is always going to go towards the way of we're preventing hospitalization and we're preventing death. And where do you as a parent feel most comfortable that you took every measure possible to prevent that hospitalization? Just like we fear influenza, just like we fear RSV, and RSV is something that we don't even have a vaccine for. How would you feel if you didn't take that opportunity to prevent that hospital trip, that ER trip? So as a blanket rule, yes, kids do fairly well. Kids tend to have a milder disease course with COVID, but if it's your child that's hospitalized and you didn't take that opportunity to vaccinate, the reward is definitely in the vaccination. Yeah,
and I will say the other risk in the vaccinating young kids is the risk to grandparents. or the risk to older people or immunocompromised people in the house, and that's a real risk. So my kids did not see their grandparents for the first year of the pandemic because we didn't want either one of them to be the vector, so to speak. And those were some joyous reunions that are a real risk there too. Okay, so a question on there about what are acceptable alternatives until we have the supply. Well, folks, no kidding. You should have these masks, and you should go get these masks because they're the ones that are most effective in our endemic, and you want to use them anytime you are in public, inside anyway. So I encourage you to go find some and get some, and we will backfill what you need for your duty. But it is certainly not our requirement at Edwards to provide them with you for 24/7, 365 in your daily lives, even if you're on active duty. So please go get some yourself and wear them as appropriate, both on and off duty. And that's a please. I can only require or demand what you do on the installation, and if you're active duty, on and off duty. But for everybody else, I think there's a good neighbor and a community requirement there. So now, if I use a multi-layer cloth and I insert a good 2.5 filter, is that good enough? The answer is no. However, that is better than just cloth, and a cloth is better than nothing. But if you look at the charts that are online there and you look at that 2x2 matrix, there's a significant increase in efficacy and benefit from the surgical mask over anything cloth, and there's a significant increase in benefit for N95, KN95 over surgical masks. And that's why we're driving to what's on my face and what's on Chief's face and what you see the doctors wearing as well. So, all right. Great question on fitness assessments. You know what I'm going to say there, Chief?
What are you going to say?
Come on, I'm going to say go talk to the Fitness Assessment Center because I trust them and it's their mission and they're going to know what to do there. And if they don't have the answers immediately, they'll consult the experts that do. And that'll be the FSS to run that up the chain. And you should see a theme here. I trust the subordinate commanders and directors to make good decisions and to consult with experts. And if there's something that surfaces that makes us want to change those policies, and we will always do that. What will the HPCon level be next week? Let me also be very candid here and say, folks, it shouldn't matter, right? What should matter is that you want to protect yourself in this rising surge and rising wave. The implementation measures that are changing are, we're going to reduce the amount of folks that are a load in the facilities. 50 people or more, you should consult with the CAG on whether or not you need a waiver for that. And we're going to start implementing mandatory mask wear of a high quality mask. Now, what the HPCon is that directs and requires all that is, I'll say, is relevant, but I think it's a secondary concern. And so I intend to keep the banners or posters up at HPCon Bravo, implementing some Charlie measures, giving us some opportunities if it gets worse before it gets better. So that's a long answer to the short question. You do the measures, pay a little bit less attention to what the poster says. All right. This is not medical. If there aren't any other medicals, ladies, I'll wish you a great weekend. Thank you very much for that. And I really appreciate what you do for the community and for those, especially the little ones in that community. Great to see you both. Be safe.
We do have one more thing, and Dr. Qualley is going to have a town hall about vaccines coming up, so that'll be posted as well.
Yeah, and that's in the slide deck. Can you show that as their get off the stage chart? Go ahead, Dr. Q.
So there are 2 dates. August is Immunization Awareness Month. So in that effort, the Med Group is having 2 lunch and learns, bring your bag lunch, 2 Club Muroc, and we will have a pediatrician on the first date of August 9th and a family med doc on August 23rd for about an hour. Any questions that you have, COVID vaccines, not COVID vaccines, shingles, pneumococcal, measles, anything that you may have, we can answer your questions, and we'll have more folks from the clinical team as well there for anyone that's interested.
Thanks, ladies. Be safe. Have a great weekend.
You too. Thank you.
All right. As my get off the stage topic on masks, remember the summary is cut off T-shirt, wrap around your face twice. So early 2020, no longer acceptable. Pull up cloth baklava. So mid 2020, no longer acceptable. Non-cloth, non-cotton nylon baklava, never acceptable and still not today, so don't do that. Good fitting cloth mask, double layered, washed, is no longer the defense that we're looking for against Omicron and is therefore so 2021. And therefore the acceptable masks are KN95s, N95s, and equivalent. And in a pinch, if you need a surgical mask, that is tolerable. But remember, they're not going to be as durable. So that's the summary on masks. And remember, it's the M in SMARTS. Do all the others as well. Okay. Thanks, folks. You're welcome to sit here and stay for it if you'd like, but you certainly don't have to. So the question is, what's been the positivity rate? And I assume they mean the single point screening test facility there. What's been the positivity rate? To be blunt and honest, I don't have that number here. I don't know if there's something else behind that question, but it hasn't been 0, by the way, and I think that's an important thing for us to note. We are doing that screening because of the community transmission rate and the drive to HPCon there for those that are not yet vaccinated. And that is the reason that we have that up and running. You can also anticipate that in the not too distant future, I'm going to do mandatory sampling of all active duty folks at a measurable or significant percentage rate as well at the single point screening test facility, independent of what that the active duty member's vaccination status is. And the why really, really matters. The why we're sending active duty folks there in a randomized fashion, think randomized drug testing, right? The why is that this is a population risk. It isn't a vaccinated versus unvaccinated risk. And you can get and carry and get sick and transmit COVID even if you're vaccinated. We can debate on how much more infectious and how much more sick you're going to be. Well, we can't debate how much more sick you're going to be, but we can certainly debate how much more infectious you're going to be, vaccinated versus unvaccinated. But this is not screening is not based on vaccination status. Screening is based on a policy for those that are not vaccinated, and the reality that screening of all folks is very important. If you're a civilian and want or need to get tested there, you are welcome to screen there, especially if your squadron commander or director thinks it's important to protect mission. All right. I think that's it so far for COVID or COVID-related things. There's a question about an ATM. So is there a plan in work to have a USAA bank or ATM built nearby? I know a lot of people, I assume now, have USAA, and I like to pull out cash from my budget binder. But if I want to deposit cash, the only way I can do that is with a money order or drive to the nearest depositing ATM, which is either Nellis or San Diego. Chief, I'll be the first to say I don't have any idea what our ATM or banking plans are here. If you do, awesome. If not, your quick thoughts, and then we'll take that one for action.
I've not heard anything on a plan. That is significant drive time to deposit money. So it would be nice if we had that option nearby. I would guess that there should be a USAA ATM closer than that, but this person's obviously done the research, sir. Yeah, I don't know.
Yeah. So the chances of there a USAA physical bank being built around here, I think that's really, really low. That's my intuition that tells me that. I have banked with USAA for a very long time, and I'm not sure that I've ever used a USAA ATM. And so I hear you on the depositing cash issue, and I don't have an easy solution for you there. But
I'm wondering if that's something you can even request to have.
Yeah. So if whoever wrote that in, if you want to work with us, and that's something we can work with the Edwards Federal Credit Union, and see what they are able to help us with or you with, and then we might be able to potentially recommend they try to partner with USAA there. So. I said there were no more questions, and then one pops. We're going to expand screening testing to everyone. I would love to be able to screen test every single person on the base. I would love to be able to do that, especially as Omicron goes up. The problem is that we don't have the supply and we don't have the throughput, and I also don't have the legal authority to direct it of retirees, veterans, and dependents that are here or other base visitors. So we'd never be able to get 100% of the folks in a mandatory fashion. I am in early discussions with the legal team on could we expand the percentage of random sampling from active duty to also include vaccinated government civilians. That will be a while before we get an answer back to that. And even if I'm told you may do that, I'm not sure I will do that. But this is the endemic world we live in, folks. And the virus doesn't care what your uniform is that you wear to work every day. It just cares that you're human. And I care about the mission that you get to participate in, and we love having your contributions too. So that's a pretty big connection there. All right, phone a friend. Spsdf, single point screening test facility, positivity rate is about 1.2%. So the numbers are about 14 positives in the last 1,100 tests over a month. So like I said, that ain't zero. And I'm not surprised that that's small, but it is much smaller than off base. Probably for a great reason, right? If somebody's not feeling well, they stay home, right? That's great. So those are likely, but I suspect all 14 of those folks were asymptomatic.
Sure.
And that's a great catch and a good example of how what the value is of that screening testing, which is why I'm expanding it to those that are on active duty independent of vaccination status in a random manner. So, all right. I don't mind getting into details. I don't know who's driving the questions, but if there are any other bigger questions on different topics, we'll get to those while I answer this one. If you can't find an N95 before Monday, the requirement won't be in effect on Monday. We're going to publish the ICD on Monday, and there'll be a few days cut in. The bottom line answer, folks, is protect yourself, please. If you don't have one already, try to find some place or something that has one and use it. It's kind of, in this endemic world, it's kind of the equivalent of wearing a seatbelt. You know, Chief has been wearing hers pretty religiously around the base. I wear mine. The reason I wear mine is I have additional risk factors. But the other reason I wear mine a lot, I don't have the schedule to take 10 days off if I get reinfected with COVID.
Same.
And that completely ignores the medical reasons why I don't want the COVID. I just flat out don't have the schedule to get sick again. Never mind all the second and third negative effects to the folks that I work with or that I love and reside with as well. So
This has definitely saved me from contracting COVID as I was pursuing leave options and travel with my children, and I just don't like getting sick.
Yeah. So to the person that answered that question, I suspect you can find one, and if you can't find one, I bet you'll be able to find. I suspect you can find one before Monday, and if you can't, then there's a phase-in timeline that'll be published in the ICD. But wear it and wear them when there's risk for you, and not just when you're required to on base. So, and you got to wear the right mask. If you're wearing a joke of a mask, well, that's just laughable, and let's not be that way. So, all right. It says we're out of questions. We're a couple minutes over on the hour. One of the things that I would like to do here is give Chief an opportunity to talk about a couple things looking forward into the rest of the summer and the fall, and then I'll do the same. So, Chief.
So, sir, starting with today, we are going to be heading over to Club Muroc to congratulate our tech sergeant, our newest selects. So that'll be something that we get into leading after this broadcast here shortly. And then coming up for the rest of the month, going into August, I'm looking forward to taking a few of our award winners, a few of our airmen out to AFSA, as well as I think AFA is right around the corner. So just a couple of things that'll allow us to get out and get some professional development. I'm also looking forward to, in a very smart manner, holding an enlisted call where we have 50 people or less, and we're all wearing the appropriate masks, and we're able to spread out and talk about some various topics that are on the minds of our airmen, to include the enlisted grade review, promotion rates, and those sorts of topics, as well as the things that impact our airmen here at Edwards, so housing, schools, recruitment, retention, those sorts of things that we kind of monitor and like to update the status for our folks on. But sir, other than that, I'm just looking forward to the weekend. I'm closing up the summer with the kids, and yeah, I'm just anticipating getting back to school for them and myself. So.
Yep, I hear you. So a couple of things I'm looking out toward air show. So the weekend after Columbus Day of 2022, it's 3 major events. So there is an open house that includes an air show. But there's also the 75th anniversary of supersonic flight celebration. That's part of the festivities that week. And then around that all, and actually the primary thrust of effort of that entire week, is a STEM event targeted for kids of all ages, but we're really trying to hit ages 3 to 13 to infect kids with geekery is cool. when they still don't have any inhibitions to that, and math is not a 4-letter word.
That's right.
So that's something I'm definitely looking forward to. Another thing along those lines I'm absolutely looking forward to is it looks like the week of 8 August, and I think we've whittled down the day, but I'll keep it the week of 8 August, we are having the formal opening ceremony for your Muroc Joint Unified School District Desert High School, Desert Junior High School, and then the grade schools that have been in operation for a little bit more than a year now. But we'll do the formal campus opening the week of 8 August. It's the estimates vary a little bit, but it's about a $160 million construction project. And the only thing that remains of the old schools there were some of the cinder blocks, a little bit of the slab, and some of the trusses on a few buildings. But even those have been completely gutted and rebuilt, and then most of the other facilities are actually completely new. The campus is spectacular, lots of multi-purpose rooms. The Performing Arts building is world class. There's an airframe and power plant shop. You'll be able to work on a pilot's license if you're in high school. The library is fantastic. Lots of other STEM and related activities that are kind of built in to the campus, and the grand opening, or the opening ceremony, the ribbon cutting ceremony, will be the week of 8 August here on Edwards Air Force Base, led by our Muroc Joint Unified School District partners. And it's a big congratulatory well done for their team in keeping a construction project on time starting in 2018. So think about where they've been, starting in 2018 with demo and then building to a grand opening of the last phase in August of 2022. That is impressive, and it is a new facility and a new campus that will be greatly appreciated by those at Edwards for many, many, many decades to come. So those are just two of the things I'm looking forward to as I look out to the calendar the next few months. And I am also, like you, Chief, looking forward to a great weekend, and I wish you all have an awesome one as well. Continue to be safe. Thank you for the engagement. I love it. Remember that it doesn't have to end here. You can text your numbers in even when we're offline, 707-412-8922. The Edwards app is also a place that you can get information from and push questions and information to us as well. And there are other social media places you can get to us. You can also reach us via email, and you can just do the old school phone call or walk in. We appreciate that too. And you can also track us down even when we're off duty. Chief and I would love to engage with you as we're out and about. So with that, everybody have a great weekend, and so long for now from Takata 2.